Good afternoon. My name is Sue Hagler, and I'm the Director of Education here at the National Community Pharmacists Association. On behalf of NCPA, I'd like to welcome you to today's education webinar, Improving Operating Efficiencies, the Pharmacy Back Office. The speaker today is Mark BonDurant. Mark is the Chief Consultant of Independent RX Consulting, a company that advises independent pharmacy owners and entrepreneurs who need peer counseling to successfully navigate the complexities of buying and starting pharmacies. Today's webinar is being recorded and will be provided on NCPA's website. When Mark finishes, we will take questions from the question and answer chat box. Please note that your questions are only visible to Mark and myself. And with that, I'll turn it over to Mark.
Okay, good morning, everybody. It is morning here because I'm coming live from Las Vegas this morning at a conference with thousands of other pharmacists talking about business. Pretty exciting. And I learned something, a new phrase about Las Vegas this week that maybe some of you have heard before, but it was new to me. And that phrase is, what happens in Las Vegas ends up on Facebook. So I thought that was a great thing to know, since it might drive some behaviors here in Las Vegas. But it's so exciting this week to be here with thousands of people, thousands of pharmacists working on their business, and being in San Diego last week and in Orlando in a week or so, where pharmacists come together to discuss the challenges that we face and to see the optimism and the determination in the pharmacists is really uplifting, because it's difficult to get pharmacists to talk about business. And why is that? Why are pharmacists hesitant to really concentrate on business? And I think the reason for that is that pharmacists by nature are servants at heart. That's why we got into the profession. That's why we do what we do. We're always concentrating on our patients and our relationships and how can we better the lives of the people that we serve. And I hope that pharmacy will never lose that focus, because that really is what our profession is. We are servants at heart. But I think sometimes, though we're so concentrated on the relationships that we have with our patients, that we sometimes lose track of the fact that our business is essential to the most important relationship that we have. That we have with our families and with our staff. For our families and everyone that works with us or for us is dependent upon us making great business decisions and keeping this business alive such that they can live the lives that they need to live. I heard a great speech yesterday from a gentleman who was the former president of Trader Joe's. And he made the statement that profits are to a business as air is to people. And what he meant by that was, we don't wake up every morning and think, how am I going to get air today? But yet, the most essential thing that we have as a person is air. We can go a little bit longer without food or water, but we can sustain hardly any time at all without air. That's the way profits are to a business. And whether you're an owner, and you can clearly see how important profits are to an owner, but I also want to speak to the employees, because frequently it's easy to say, well, the profits of the business are not my issue. But what I hope to get across today is that profits are the air of a business, and your families and your co-workers are dependent upon anyone that works in that organization to make sure that there's air in that business. So today what we're going to do is look for ways that we become more efficient and understand what are the things that we need to focus on such that our business can sustain. Because pharmacy business can be somewhat daunting. It can seem like there's thousands of things that can influence our business, and how do we sift through all of that so that we can get down to what's really important to us? Because I think efficiency frequently comes from simplification. If we can concentrate on the important factors and eventually get to the other factors, then I think we're in a better position to grow and sustain our business. Think of it this way. How easy would it be to be a doctor if there were only 3 diseases? And so every patient that came to you, you knew that it wasn't one of a million things that could be wrong with them. It's one of three. It would be very easy to make a diagnosis, correct? Or last night we went out and we had a great meal and there were probably 50 things on the menu. And I'm thinking, how complex is it for that kitchen to be able to be experts on all 50 things? But what if there were only three? What if there were three things on the menu? How great would those three things be? So today, as we go through the slides, I want to focus on what are the three things, just three, that are the biggest influencers on the sustainability of our business, and how do we concentrate and how do we see, how do we diagnose if there's a problem in any one of those three areas, and then what can we do about it? So that is the overall goal for today. So let's start. How do we get to the bottom line? How do we see the profits or the air that is in our business? And most of you have seen a profit and loss statement, and as you know, a profit and loss statement is divided into three parts. It starts at the top with revenue. From that revenue, we subtract the cost of goods, and that yields a gross profit. Now, it would be great if the gross profit was the number we all got to take home, but as we know, that's not the case, because from gross profit, we need to subtract expenses, and that leads to a net profit. So if you look at the three things that we need to concentrate on, what are the three things that lead to the bottom line? And those three things are revenues, cost of goods, and expenses. Put another way, it's all about three P's. Patients are going to determine your revenues. Your purchasing is going to determine your cost of goods, and for the most part, your payroll is going to determine your expenses. So as we try to concentrate on our business, what are we going to be concerned with? Our patients, our purchasing, and our payroll. So how do patients influence revenue? There are three main ways that patients can bring revenue into your store, and that is, how many patients do you have? And not only that, per patient, how much sales are those patients generating? And that is not the same metric, and we'll get into that in a second. Secondly, of those patients, what is the payer mix? What type of insurance, or who is paying for those prescriptions that the patients consume? And the third factor is, what type of products are those patients purchasing? I really won't spend much time today discussing over-the-counter products, because in most independent pharmacies, we see well over 90% of the products that are purchased are prescription-wise, and most of the talk today centers on a traditional independent pharmacy. Certainly if compounding or specialty is involved, it can certainly change that product mix significantly. So from the patient standpoint, let's talk about how many patients we have. Well, that's easy to see, that the more patients that you have, the more revenues they're going to bring in. So what kinds of things are we going to be monitoring to determine how many we have? Are we gaining new patients? Are we losing patients? Or do we see transfers in, out? And also important is, how many prescriptions per patient do we have? It's a very important metric that we need to monitor. And lastly, are we conducting the clinical services and the MTMs that are necessary such that our revenues are not decreased by reimbursement issues, and also that our patients are being served? So what type of a report do we need to run? The data that you'll see today is taken, I'm a COO, we run 17 drugstores, and so the data that you see today is data from my stores. So if it doesn't quite jive with the digest or your store, you'll know where that came from. But in this case, let's compare store number 1 and store number 2. And what we see here is that store number 1 fills substantially more prescriptions than store number 2. Yet we also see that store number 2 has more patients than store number 1. So what does this tell us about these two stores? Well, as I would look at this and analyze this, if I was consulting a pharmacy, I would say that store 2 is most likely not doing as good a job on their MedSync and compliance as Store 1, because Store 1 is maximizing their patients such that they're getting more prescriptions per patient and resulting in higher profits and higher revenues for that store. As a sidelight here, also we're going to look at how many new prescriptions and how many refills each store is filling. And you'll notice that Store 1 is 52% new prescriptions while Store 2 is 43%. And that number is also significant because traditionally a good drugstore is somewhere around 50% new prescriptions, perhaps between 45 and 50. As we get down into the low 40s or perhaps into the 30s where your percent of new prescriptions is in 30, that would indicate to me as an analyst that that is a stagnant drugstore and that we need to make some changes in that drugstore, or it will, over time, profits will erode. So that's kind of a sidelight there. But what I really want to point out to you is this is an important thing for you to know in your pharmacy, is how many patients do I have and how am I maximizing each one of those patients. The next factor that can influence revenues is the payer mix, and this is the one that we get so concentrated on, because frequently here's where we feel that we're helpless. But you can't make a good decision if you don't know where your payer mix is coming from. Frequently I talk to people and they'll concentrate so much on one bad payer. And they'll say, my whole store is suffering because of XYZ. In many cases, they probably are right. But when I ask them, what does your data show? What percent of your business is that payer? Who are the top 10 payers that you have? And frequently they do not know. That's a very dangerous thing not to know, because it's probably the highest determinant of what revenues are in the store. So what do we need to know about our payers? Who are the top players? What is the average price for each of these? What customers pay cash? These are the things that we need to know. Let's compare store PBM1 to PBM2. And this is a rather extreme example. But what I did was take the top payer in my chart and the bottom payer, and just so you can see the extreme difference. And you can see that in one payer we have an average prescription price of $38, while the second payer is at $84. Quite a bit of difference. What does that tell you? That means that payer 2 probably has more brand name mix. But if you look at the average margin per prescription for 2, we've got one at $7, the other at $23. Now, I agree, it's very seldom to see an average of $23 from anyone in today's world. In fact, the 7 is probably more real. But what this points out to, and what I want you to recognize, is that there can be significant difference in your payer mix. And frequently, as I diagnose, if someone comes to me and says, what's wrong with my pharmacy? One of the major things that I see is that they've got a bad payer mix. And so it's very important to know who is paying the bills and exactly what this data is. So as a sidelight to this, I'll tell you, if you do not have accurate acquisition costs in your computer, then you'll never be able to know the answer to this question. So one of the main objectives, if you do not have today accurate acquisition costs in your computer, you should make that your number one priority of everything you do, because it's impossible to diagnose a problem in your pharmacy if you don't have good data, because everything on this page is determined by the fact that you have accurate costs in your computer. Because as a doctor, you would never be able to diagnose a disease or treat a disease if you can't make an accurate diagnosis. And data is the way you make your diagnosis. So in this case, we can see a big spread in PBM1 to PBM2. Well, what can that mean to us? Frequently, as all of you know, in the first of the year, we see a lot of turnover in our payer mix because people choose different plans, different things happen. So at the first of the year, we may see a drastic increase or decrease in our sales depending upon people switching their payer mix. Or even more common is that also the first of the year and sometimes around the middle of the year, within a payer, they change the reimbursement model, and you'll see major swings in your business because one of your major payers has made a change. So it's important that you run this type of report and you run it on at least a monthly basis so that you can immediately identify what's happening in your business so that you can make an accurate diagnosis so that you can see what can I do to treat that. So the second big factor that we see in top-line sales, we've talked about patients and we've talked about payers. And the third is the product mix. It can be a big swing if you have a lot of generic drugs or brand name drugs, can greatly influence how large your top-line sales are. What can influence it even more is if you add compounding or specialty, you're going to see a large increase in top-line sales. Now, does that necessarily mean that you're going to make more money because you sell more brand names? Not necessarily, because as we all know, that also the cost of goods comes higher as well. But as we talk about top-line sales, it's a major difference if you sell a lot of brand names versus a lot of generics. What's important here is to kind of monitor what is the overall price of my prescription, because that will determine, what's going on with my sales. Just as an example, a few years ago, Nexium went generic. So at that time, Nexium sold for maybe $320. It came out on generic. It sold for about $50, just round numbers. But the point I want to make here is that in this pharmacy, they saw a decrease in sales of $54,000 a month on this one factor alone. So in this case, they were not losing patients. The payers were not changing their reimbursement model. What was causing the dip in this pharmacy sales was that one factor of losing the high dollar brand name cost going to a generic. Now, does this mean that they made less money? Not necessarily, because that generic Nexium also, the cost of goods was less. But again, what we're focusing on now is what are the things that drive top-line sales, and your product mix can certainly make a big difference in that top-line sales. For we can see, in this case, an average generic price was $26, an average brand name price is $243 for this particular store. Easy to see how that can be a major factor in your top-line sales. So, what are the things that can make sales decrease? And those are less patients, less prescriptions per patient, change in reimbursement, perhaps a shift in branded generic, and certainly DIR fees can come into play there. So what things are we going to concentrate on for top-line sales? As we look and our top-line sales are either increasing or decreasing, what are the things we're going to look at? We're going to look at our patients. We're going to look at our payers. And we're going to look at our products. And that will determine what is the effect of our top-line sales. Are we growing or are we decreasing? And here's the important thing. So now that we've made a diagnosis, what are we going to do about it? Because it does no good to say, well, here's what's wrong, if we can't offer a solution. And in this case, let's start with our analysis says that we're declining patients. What should be our focus? Our focus there should be on our marketing, but even more important, it's on the second one, stronger relationships. We're in a relationship business. And when I mean stronger relationships, that should be with your patients, that should be with your referral sources, that should be with your suppliers, because that's going to drive your top-line sales. So what should you do if you don't have enough patients? I think there is where you need to get more active in your communities. You need to have reach out to your local providers and make sure they know the services that you provide, because you need to build stronger relationships to sustain your patient base. So how about the second person? We don't have enough prescriptions per patient. We see, like the example that I showed you earlier, where there seems to be plenty of patients. However, we're only getting 1 or 2 prescriptions per patient. What might we do there? And the answer to that, of course, is MedSync and compliance, refill reminders, anything that you can do to make sure that those patients are taking the meds that they have and make it as easy for them as possible to do is going to increase your prescriptions per patient. And that might be the most important thing of all of these. Certainly if we see a shift of brand to generic, that focus now comes into our purchasing. Are we purchasing those generic drugs in the best way possible that we can increase our sales? And lastly, the one that you hear all the time, okay, well, I've done everything right, Mark, but there's nothing I can do. The PBMs have shifted, my reimbursements have decreased, and I am totally helpless because there's no lever I can pull. In fact, that's when you need to really become alert. When your reimbursements decrease, which we're seeing, as you know, in the marketplace every day, that's when we need to do everything. That's where we need to market and increase our relationships to get new customers. That would signify that we need to do sync fill to make sure that the people are compliant and we're increasing the number of prescriptions per patient. And we also need to, and we'll get to this towards the end of the presentation, we need to make sure that our expenses are in line with our new realities. And the number one thing I see that people do not do, and what causes the pharmacy to become less profitable, is that they don't change their methods as a result of decreased reimbursements. It doesn't help any of us to say, oh, poor me, my reimbursements are down and there's nothing I can do about it. That's where you need to kick it all in. Market, get the sync fill, reduce expenses. Very, very important for survival in today's market. So how do you monitor that? What is the key report? What are the things that you need to make sure that you're watching in my case, every 2 weeks? And why do I monitor these on a 2-week basis versus a 1 week or a monthly basis? I monitor my key metrics every 2 weeks because that's how often that my payroll comes out. So I can take these statistics and look at what my sales were for that time period and balance that with what is my payroll. It's not on this chart, but that certainly would be another category I would have. So as you look at what are the key things, what are my sales doing? How many prescriptions am I filling, which is probably the most important determinant of your pharmacy. What is the average price, average gross margin? Am I seeing around 50% new prescriptions? Am I seeing new patients? Am I losing patients? And how many prescriptions per patient am I seeing? And you monitor those things over time. And the reason that you monitor those things over time is because that will help you diagnose, to back up one slide, which one of these problems do you see? And if you monitor it every 2 weeks, you don't need to wait for it to happen to solve the problem. Frequently, we'll see owners that wait for their financial reports to come out before they realize they have a problem. I think it's important to monitor your key metrics so that you can make your diagnosis early so that you can act before it becomes a problem versus after. So these are the key metrics that I would like to look at as an overseer of my pharmacies. So we've talked about top-line sales. Let's go forward. What's the second member of the big three, and that's purchasing. And the point I want to bring out here is that in an average pharmacy, 77 cents of every dollar that you bring in goes towards one thing, and that is purchasing. 77 cents goes into buying something else. So let's just think for a minute the rationale behind that. So if 77% of your dollar goes to one thing, what is one of the most important things that you should focus on in your pharmacy? Obviously. Should we look at the 23? Yes. But let's go look at the 77. Purchasing can be a major determinant in profits, or how do you get to the bottom line. So what are the three factors that determine your purchasing? The first is your wholesaler contract. And here's where I see a lot of pharmacists, and especially the employee pharmacist. As an employee pharmacist, you may not think this is important to understand about what is your contract and what is your cost of goods. And even more important, how do you maximize the rebates that may be structured in that contract? And if you're an owner and you're not sharing this with your personnel, I would encourage you to do so, because everyone needs to be a part of this. Because maximizing that contract and making sure that you're purchasing in a way that is totally to your advantage is perhaps the most important thing you do, because again, we're talking 73 cents of every dollar. Secondly, are there things that it's advantageous for you to not purchase through your wholesale contract and buy through a secondary? That also can be somewhat confusing. But again, if you don't have a really good understanding of your wholesale contract and the effects of buying something from a secondary, then you're really cheating your business, because those rebates are important, but also the secondary purchasing can also be important. And lastly, are you making good buying decisions? Is your inventory good, and are you purchasing the correct things? Or are you making buying decisions that result in outdated drugs, which can be devastating to your pharmacy? As an example, for one of our stores, if we would see just a 1% decrease in brand name cost by maximizing our purchasing and getting the correct levels into our contract, we could see a 7% increase in our net profits. Likewise, if we could see a 5% increase in generic costs by buying the correct things from our wholesalers and using our secondaries correctly, rebates, we can see a 16% increase in our net profits simply by being better purchasers of generic drugs. Likewise, if we ignore our contract and we purchase the wrong things from the wrong people and we lose our rebate, and the rebate is completely non-existent, it can take most of your profits for that month in an average store away. So you have to be cognizant of what are the things that I can buy, how much can I buy, and how can I take my contract and work it to maximize the value that I have. Very important. Likewise, if I buy bad items and they become outdated, and even if 2%, in this case of the store, if 2% of what I buy, which is a very small percent, if 2% becomes outdated, it can decrease my net profits by 22%. So making good purchasing decisions is so important. And frequently we'll see a situation like this where a bottle of medicine costs $1,000 and we get a prescription for $30, and all of a sudden we've sold 30 of those, so now we've made a sale of $300. However, it's left us with $700 of unused inventory on the shelf that goes outdated. Well, have you made a profit on that? You could say, well, yeah, I did. I made $20 when I sold that. Well, you didn't, because you also lost $700 when it went outdated. So making good purchasing decisions. When do you buy the correct bottle sizes? Is it possible to get from one of your other stores if you have multiple stores for partial bottles? How you can handle that, using services perhaps that are able to sell your partial bottles to other stores. In some states that's allowed. Those are all really important, because decreasing outdates is an important part of your purchasing decision. So we've talked about two out of three. We've talked about your top-line sales and your cost of goods. And what is the last of the big three is people. So you look at this slide, and it says payroll benefits. And frequently when I'm making this presentation, people go, that must be a typo. He didn't mean to say that twice. Well, I did mean to say that twice, because when you're talking about expenses, the major expense that in any pharmacy that you have is your people. For instance, we have 3 stores here that I compare. And what I want you to do here is take your eyes to about halfway down the screen, and where it starts to say rent, advertising, pharmacy supplies, vehicle expense, and blah, blah, blah. And look over into the third column, where those percents are what percent of sales does that expense account for. And if you'll notice, rent, 0.64, 0.88, 0.44, 0.17, all of those numbers are relatively small, and in most cases they're less than 1%. Whereas, let's go look at the payroll cost. What is the payroll cost of this store? And that's at 10%. So when you're looking at expenses and you want to make a difference in your expenses, where is that difference going to come from? Is it going to come because you turn off the lights at night and your electric bill is down? Well, pennies turn into dollars. That can influence it. Is it going to come because you buy your vials at a better price? Perhaps. But if you're really going to swing the pendulum, where are you going to swing it? And that's at payroll cost. Now, this can get a little bit touchy because, again, I'm talking to both owners and I'm talking to employees. And frequently employees see this as a negative because they see, wow, now you're talking about decreasing my payroll. And I'm not talking about decreasing your payroll. What I'm talking about is setting a budget and holding to it such that you can sustain the profits of the business, such that your business has air to breathe. And as an employee, it's just as important for you to help that system because you need that business to sustain. So payroll as a percent of sales is perhaps the most important thing with expenses. And here's a chart that kind of tells you how many prescriptions you fill per day, about what kind of goal is realistic to set as a payroll as a percent of sales. And you see when we get to about 180 to 200 prescriptions a day, that number is set at about 10%. So why 10%? Why is that so important? Well, let's do a little math problem. Let's go back, and an average pharmacy runs a gross margin of 23. As we said, 77% of that dollar goes to purchase something. So that leaves you with 23%. If you look at the other expenses that are non-payroll expenses of an average pharmacy, they're somewhere around 8%. So if we take 23% minus 8%, that leaves us 15. If our payroll as a percent of sales is 15%, what does that leave to put air into our business? Well, let's do that math. 23 minus 8 is 15. 15 minus 15 is 0. So if we continue to run our pharmacy that way, as an owner, what are you going to be faced with? You're going to be faced with a business that has no profits. And businesses that have no profits are like people with no air. They will not exist. As an employee, if your employer or your boss continues to run his business such that his payroll eats up all of the profits, what does that mean for you? What that means for you is that most likely that business is not going to be there for you and your family in the future. And so that payroll budget can be equally as important to you as it is to that owner. So the first thing in determining to say how can I handle my payroll is to know what are the employees costing your business. And frequently, certainly if you ask someone, how much do you make an hour? In this case here, we have a technician, and I'm sure if you asked this person and said, how much do you make an hour? And the answer to that is, well, I make $15 an hour. But as an owner or as a manager, and to effectively manage your payroll, that's not the number that you're concerned with. What does that person cost per hour? So in this case, we're taking 15 times 40, and that person makes $2,580 per month. When we add the payroll taxes that the business has to add to sustain that employee, we add on 180. The business part of the health insurance is 500. If we amortize the vacation cost over a monthly basis, that's 100. So we see that the monthly cost for that employee is not $2,500, it's $33. And when we divide that by the hours, we see the effective rate of that employee is not $15 an hour, it's $19.54 per hour. So as we look at adding benefits or not having benefits to our employees, or the mix of kind of people that we have, do we have employees that all are on benefits, or do we have some that are not? It can greatly affect the effective rate. So what we would want to do from there is take the conglomerate of all the employees, and I like to separate pharmacists from all other employees, and say, what is the average effective rate of everyone that's not a pharmacist in my store. And I come up and I know that number. And that allows me to do this. This allows me to set a payroll budget. And the way this works is this: if we go down to line 4 and we say there's how much sales we have per week. And at this number it's $59,400. And if our payroll goal is 10% of sales, we've got $5,940 to spend. Well, you cannot operate a pharmacy without a pharmacist. So the first thing we do is say, how many hours are we open, and what am I going to have to pay a pharmacist to staff those hours? Because you cannot sustain a pharmacy, nor can you open one if you don't have a pharmacist. So in this case, we're open 56 hours, and the effective rate of that pharmacist is 65. So we're going to deduct $3,640 off of that. That leaves $2,300 for everybody else. We've done our homework from the previous slide, and we know that the average effective rate for the technicians is $14 per hour, as an example. And so if we divide $2,300 by how much we have to spend by the average effective rate, we can see that we can afford to schedule that week 164 patients. Now, a lot of you are probably in situations where you feel like you don't have enough help, or you feel like, what is that owner doing? It seems like he's always cutting our payroll. And I guess I would look at this and say that hopefully your owner is not making that decision out of greed. If he's making that decision out of a sound business decision, he's doing you all a favor. And frequently what I hear from people is that this is impossible. I see this formula and you give me these hours, but there's no way that I can operate my store like that. I have to have more payroll hours to do this. And I would caution you that while that may be true, I think the real answer is you need to find better ways to serve your patients such that you can get your payroll under control, because again, we've got to do the math. 23 minus 8 is 15. If you use all 15, the answer is 0. 0 is unsustainable. There's no air in that business. So it's important as owners or as managers to set these budgets, and it's important as employees to work within these budgets, as difficult as that may seem, because that is what is sustaining your store. And the number one thing that I see when I'm analyzing or looking at people's stores that are on the critical list, the number one thing they do not do is they see their reimbursements go down, but they never adjust their payroll budget. And therefore, there are no profits in the business. By the same token, again, to go back to the employees, why is this important to you? If your owner or manager would totally buy into this gospel, how do you do better as an employee? Well, the way you do better as an employee is you increase sales, because if you increase sales and they stick to the number of percent of sales, there's more money to spend, and that money should go to you and your staff. Because here's an interesting thing. I ask people sometimes, how much do you think an extra 15 would cost you? And you can kind of do the math and say, well, let's see, it's $15 an hour, and they work 40 hours a week. That's $600, and so $600, that's about $30,000 a year. So they cost me about $30 a year. So I ask, how much sales would you have to generate to pay for that one extra technician? And frequently the answer I get, well, I would need to go find $300,000 or $30,000 worth of sales, because they cost me $30,000, and if I get that many sales, then I'll just use that money and I'll pay that technician. But that's not true, because again, 73% of every dollar you don't get to keep. You have to buy something else. There are expenses that go with that sale that there's no way to get around. And so when you do the math and you work it out, in this case, you would need to generate $227,000 of sales to just make up for one extra technician that you may or may not need. And that's substantial. In this store alone, that would be 14 prescriptions a day just to pay for that one extra help. Now, if it fits in your budget, that's great. But if that's over your budget, then again, $227,000 of sales are used just to support that. In a pharmacist case, how much does it cost to support 20 extra hours of pharmacists a week for overlaps so that there's not as much stress in the pharmacy? In that case, it's almost $500,000 just to do that. So getting a realistic budget and sticking with it is probably the most important important factor that you have. So how do I do that? Because frequently people say, there's no way, Mark, I need all these people to serve my patients. And I'm not in any way saying that as independent pharmacies, we should let our patient service suffer. It has to be there. That's all we have to sell is the service and the relationships with our people. So we have to see that. But there are things you can do. For instance, here in store, let's compare store 1 and store 5. And we go back to how many prescriptions are in the bag of our average patient. Because in store 1, on an average day, they have to wait on 109 people. In store 5, to get just a few less prescriptions per day, they're waiting on twice as many people. Well, what does that tell you about this store? That tells me that store 5 is not doing a good job with compliance, that they are not doing a good job with MedSync, and so they're working much harder than they need to. So when you look at your payroll budget, your first reaction shouldn't be, if you're over your budget, to say, well, I guess that's just the way it is. That's what I need to do. Your first reaction should be, how can I fix that? What can I do to get more efficient in my store so that I can get my payroll where it needs to be? As we continue down, there are other expenses. And what's important here, and I bring this chart forward just to bring the next chart up, it's knowing as an owner or a manager, what does it cost me to dispense a prescription? It's important now that your financials are very correct and that your expenses are recorded correctly and that that you amortize things correctly, such that you can take your total, you can look at your profit and loss statement each month and say, there's my total expenses and here's how many prescriptions I filled, so there's what my total cost of dispense is. Because then you'll know, you can see what is my average gross profit per prescription, and what you're hoping for there is certainly that it is greater than your cost of dispense. Let me back up 1 second here. So in this case, these stores are about between $9 and $10 as a total cost of dispense. So there are other expenses that we can control or we have to look at, the transaction fees, the supplies. And the third one is the cost of delivery. Frequently as independent pharmacies, we have free delivery. And this is another important number to calculate. What are all the expenses involved in doing a delivery, including the driver's salary and so forth and payment? And in this case, a delivery cost about $6. Well, if we back up a couple slides, and we see that the average cost to dispense a non-delivery prescription is $9, and the average cost for a delivery is $6, the average gross profit that we make is somewhere around 11 or 12. So if we deliver this prescription and there's only one prescription in that bag, it cost us $15 to process that prescription, and we only made maybe 11 or 12. So the key to this is, who should be your number one target for MedSync? It should be your delivery patients. And in fact, I think a rule to have in many pharmacies, depending on your product mix, is that yes, we have free delivery, but we only have free delivery if you sign up for our MedSync program, because we need to be able to deliver to you once a month, not once a day. And if you're delivering to people once a day, I can pretty well tell you that your profits on those prescriptions are minimal at best. So, yes, there's thousands of things that can influence our pharmacy business, but what are the 3 things that we need to think about? And so let's go back and review. What are the 3? Patients. How can we increase these patient counts? We can increase our patient counts by increasing our relationships with those people, such that they're raving fans of ours, that they're telling their families about us. We can maximize the patients by asking them, by getting them on compliance, perhaps using the packaging to help them with their compliance. also along with the patients. Another thing I would encourage you to do is ask your patients, are there any other prescriptions you're getting anywhere else that I could do for you, such that you're getting more prescriptions per patient? I once was in a pharmacist meeting, and I had 15 of my pharmacy managers there, and to start the meeting, I said, everybody get in your wallet and give me $1. And what happened was everybody got in their wallet and put $1 on the table. And I asked them, why did you give me that $1? And the answer was, because you asked. And I said, exactly. That's what I'm saying. Why can't we ask the patients, is there anything else I can do for you? And frequently what you'll see is perhaps they're getting a prescription or two on their mail away that they thought was a good deal that's not. Or perhaps they just always got the prescription for their husband over at another store and never really thought to transfer it. Or perhaps they just started taking care of their mother who has traditionally gone to a different pharmacy. And you can ask, can I help your family? That's one way you can certainly increase your patients and maximize those patients. Now we're going to look at the payer mix, and there you just need to be aware of what's happening so that you know how quickly you'll need to make changes in your business to compensate for a bad payer mix. Again, MedSync is really the key for your patients because that's going to increase all. If you look at MedSync, it's the answer to all problems, and I'll get into that in a second. Or it's not the total answer, but it certainly is a factor. When we look at purchasing, what we're going to really concentrate on is knowing our contract and how do we buy within that contract such that it's maximizing our values. Again, how does MedSync help your purchasing? MedSync can be the number one thing that can help your purchasing because now instead of having to buy items and waiting for people to purchase them from you, you can anticipate when are those items going to be needed in your store. You can order them the day before, dispense them the day later, greatly increases your efficiency on your purchasing power. When it comes to people, what decisions do you have to make? What is your payroll budget and how can you stick to it? What benefits do you need to offer those people and what percent of your people can you afford to give your benefits to? What is your mix of part-time versus full-time people such that you can manage that within your budget? What is your cost of dispense? And then lastly, once again, you can get by with less payroll if you're doing a great job on MedSync. So to me, MedSync helps everything. It increases your sales, makes you better on your inventory, and lastly, I do believe that MedSync might be the key to world peace. I'm not sure about that one. So real quickly, we have about 10 minutes left, and I'll rush through this one a little bit quicker so that I've got time to answer perhaps a couple questions. So now that we have profits, so now that we've managed our top line sales, we've been good purchasers, we're controlling our payroll, and we see, yes, look, I made $10,000 this month, or I've got profits. For those of you who are not owners, if you ever become an owner, the biggest difference between getting a paycheck and getting profits as a business is that now that you've got profit, when you get a paycheck, you get to take it home or you get to take it to the bank. In most cases now it's just deposited in your bank account and it's yours. And if you've earned $1,000 that week, then you get $1,000. As a business owner, when you get down to the profit line, it may say that you made $1,000. Does that mean that you get $1,000 that you get to take home? Well, not necessarily. Well, what happens to that? That comes into a factor called cash flow. And the three biggest things with cash flow is, do you have excessive inventory? Are your payables or receivables increasing or decreasing? And do you have a loan payment to make? And since we're pressed for time, I'll go through one example. Inventory is the biggest factor. As I said before, when people come to me with an ailing store and say, look, Mark, what is my problem? The first thing that I always look at is their payroll, but the second thing I always look at is their inventory, because frequently what's happened is they purchased so much extra inventory that all of their cash is now sitting on their shelf. So let's look at this example. In this case, a pharmacy got to their bottom line, and it says that they made $10,000. but the inventory at the beginning of the month was $200,000, and now it's $220,000. Well, first of all, what made that happen? What made that happen was they purchased more than they needed to purchase. So now the inventory is up $20,000. Well, what happened to their cash? Well, they made $10,000, but $20,000 of that money is now sitting on their shelf. So the net effect of this for this individual pharmacy owner is that they now have $10,000 less in cash, even though they made $10,000 than they did previously. Here's a real complex example, but I'll kind of go over that. Since we're pressed for time, I'll kind of go past that. But basically, these are the three big factors that affect your cash flow. What happened to your inventory? What happened to your accounts receivable? Accounts receivable, of course, is money that insurance companies owe you. And is a high accounts receivable number a good thing? Well, in some ways it is. Would you like me to owe you $100? Well, yeah, because at some point I'm going to pay you $100. That would be good to have. But for you $100, who has the $100 in their wallet right now? That would be me, not you. So an increase in accounts receivable can also result in an owner having decreased cash flow. Likewise, an accounts payable, money that you would owe your wholesaler or other vendors, as that increases, that helps your cash flow because now you owe them, but the money is still in your wallet. So you can use this chart to kind of play with it and see, okay, what are all the factors with cash flow? And essentially, here's what that comes down to. An increase in inventory will always lead to a decrease in cash flow. An increase in accounts receivable will also decrease the cash flow. Anytime you make a loan principal payment, because a loan principal payment is similar to what you see with your taxes. When you do taxes on your individual taxes, you'll know that your interest on your home is deductible, but the principal is not. Likewise, on a profit and loss statement, the interest may appear on the profit and loss statement, but the loan principal does not appear on that profit loss statement. So that is a decrease in your cash flow when you make that principal payment. And likewise, accounts payable, when it increases, will decrease your cash flow. So what are the three things that we really need to think about? We've talked about the top line sales, the cost of goods, the expenses, but if you have to really say, what are the three things I need to do in my pharmacy to make sure that it's healthy? And I would challenge you to say this: build strong relationships. Make sure that you're good with your providers and with your patients such that they are doing your advertising for you. Make sure that you have a strong relationship with your wholesaler and your secondary such that you're a good purchaser, because that can also greatly affect the bottom line. Control the payroll as a percent of sales, because having and sticking to it is a major determinant on whether or not your pharmacy is healthy and whether there's air in your business. And lastly, go all in on MedSync. It can be really frustrating. I can guarantee you, if you're not doing MedSync and you start, that you're going to fumble, that things are going to not go easily, because it can be a really complicated thing. But get with your software vendors and study how can I do this within my software. Talk to other pharmacists and say, how are you doing this? And just start with one patient. Start with a patient that has a complex regimen and is willing to forgive you for the fact that everything didn't go as smoothly as you thought it would. Work it out, and then take two patients. Then go to your delivery patients. Get your delivery patients MedSync. And eventually, the good pharmacies today are well above 50% of their business are on MedSync patients. That will improve your top-line sales, make you better purchasers, keep your expenses, and make sure that there's air in the business. So that would conclude the presentation, and I think I have time maybe for just a couple questions. So Sue, do you want to join in here and guide me through on what I need to do from here?
Sure. So the first question was back at the beginning of the presentation, and it's, are those monthly new scripts annual?
Are those monthly new prescriptions or annual? In this case, the chart that I was using was a 2-week chart. So those are new scripts that happened within that 2 weeks.
The next question is, how did you get to the average price of generic to $22.31? His pharmacy sees closer to $2 for generics, and he knows that this impacts rebate.
Well, this is an average price, not an average gross profit. Again, I would take the total sales of my generic drugs, which is available on any kind of pharmacy software. You can say, what was the total price of everything I sold generic, and that's the total price, not the cost, and divide that by the number of prescriptions, and that's where that number came from.
How is your generic purchases only 30%?
The dispensing of generics, what percent of drugs that are dispensed are generics is way higher than that. But when you take the average cost of a brand name drug, it's so much higher that your actual purchases are usually between 22 to 30% of generics because of the fact that they cost so much less as a percent of total purchases.
In response to the price of generics, he responded that his total price is still closer to $2. The next question is that just wanted to verify that an increase with accounts payable will increase cash flow or decrease.
An increase in accounts payable will increase cash flow. Now, at least temporarily. Obviously, if it's an accounts payable, at some point you have to pay it. Now, when you pay it, that's going to take your cash. But if you look at what was my accounts payable at the beginning of the month compared to what it is at the end of the month, if it's higher at the end of the month than it was at the beginning, that is cash that you still have in your business. Now, you may have, like I say, over the long term, you're going to have to pay that. But it certainly will increase your cash flow. And again, what that means is if I owe you money, who has the money in their wallet right now? That's me. So eventually I have to pay you money. When I pay you money, what happens to that money? Well, now it's in your wallet and it decreases my cash flow. But an accounts payable, actually, a change in accounts payable for the positive also increases your cash flow.
And as far as the generic price, again, a follow-up to his earlier question, his total price of generics is $250, not sales.
I don't see how that's possible, but that could be in your particular store. I'd have to look at the data, but in the hundreds of stores that I've studied, I've not seen that low of a number ever. So,
just for the information for the next webinar, which is going to be August 8th, it's going to be held at 2 p.m. Eastern, and it's preparing for flu season, point-of-care testing in the pharmacy. So no other questions have come through. We would like to thank Mark for the excellent presentation today. And on behalf of NCPA, I'd like to thank you for joining the webinar today. Please stay tuned to the NCPA website, which is ncpanet.org, and QAM daily newsletters for the registration information for the next NCPA Innovation Center education webinar, as well as other exclusive NCPA benefits that are available to you. Thank you, everyone. We appreciate you joining. Have a good day.